Hi everybody, and welcome to Chapter 13 on Stress, Coping, and Health. So for our outline today, we are going to start off by defining stress. We are going to look at the appraisal process. We are going to look at major types of stress. And then we are going to discuss emotional, physiological, and behavioral responses to stress. We are going to define coping and discuss constructive coping, so healthy, adaptive ways of coping. And then we are going to look at the effects of stress on physical health. We are going to discuss moderating effects that can prevent the negative effects of stress. And we are going to discuss reactions to illness and barriers to treatment. So that will make more sense at the end of the lecture when we get there. All right, so first up, the nature of stress, so how we perceive stress and the major types of stress. All right, so what is stress? What are some things that cause you to feel stressed or stressed out every day? So stress can be any circumstances that threaten or are perceived to threaten our well-being and tax our coping abilities. So it doesn't necessarily mean that our physical well-being is threatened, like we're not in danger of being physically harmed or even worse than that, right? It could be anything that just seems threatening to us. Like we don't feel like we have enough resources or a good enough capability to really tackle whatever the situation is. Traumatic events have been linked to increased psychological problems and physical illness. So we're not going to cover it until the end of the semester, but when we get to the chapter on psychological disorders, you will notice, and I will point out, that stress is an underlying factor, like a contributing factor for every single mental illness out there. So depression, post-traumatic stress disorder, even things like obsessive compulsive disorder. So stress underlies lots of issues that we have as humans. And even if it doesn't get to the point where we have a full-on diagnosable condition, we at least see effects of stress in our daily lives. So not surprisingly, traumatic things. So big changes, big things that disrupt our normal functioning, those things can lead to stress. And then that stress that we suffer from as a result of the trauma can then lead to our development of a disorder, be it mental or physical. And traumatic events can be like a major injury. So you could gravely injure like your leg or something, or have to have like a limb amputated. You could be in a really bad car accident. You could lose a loved one. You could be the victim of assault. So there are lots of things that could be considered traumatic that can later cause to deeper psychological and physical issues. But those are the big things, right? We probably don't even really think about trauma as stress. I mean, it is stress, but we don't really perceive it that way because I think a lot of times when we think about stress, we think about the everyday things that are going on. So minor everyday stressors can also have a big impact on our overall health. So it's lots of little things that are constantly causing us to spend our time and attention dealing with them. And so even though they may be small, when you look at it cumulatively, we can all have negative effects from the everyday stressors that we deal with. So again, the effects are cumulative. So having 5 stressful things happen every single day to you could potentially look the same as one big stressful traumatic event. There's kind of our bodies don't know to process these types of stress differently. All right, so the first step in the appearance of something being stressful is appraisal. So according to Lazarus and Folkman, a study from 1984, they looked at, they distinguished between primary and secondary appraisal. So primary appraisal is our initial evaluation of a situation. So say for instance, you are taking an intro to psych class. You may see that you have a big project. Maybe you have the written assignment coming up. The due date is fast approaching and you realize that you've got a lot of other things going on too. You may have a lot of things going on with school, so in your other classes, you may have a lot of family things going on, you may get sick. So any number of things could be happening, and you look at that situation. So your initial evaluation may be, wow, this is stressful. And even if you don't put it in those terms, you look at it and it kind of freaks you out because you just don't feel like you have enough time and attention to get to everything. So in that primary appraisal process, we then look at, is it relevant? So having an assignment due in your psychology class is definitely relevant to you. But if you're the one taking intro to psych and you have a friend who's taking other classes, like they're not going to be stressed out that you have an assignment due. Then you also look at, is it threatening? So just because you have a big assignment due in a class doesn't mean that you don't have the skills or the ability or the time to work on it. So say you do have your written assignment due for Psych 1, but it's due a little bit before the end of the semester. So all of your other major projects and final exams are the last week of school. So maybe you're just like, hey, I'm getting an early enough start. I've got time. You may find yourself in a position where you're lucky enough to have your schoolwork kind of staggered. Not everything's due at once. And then you determine, is it stressful? So if you have your assignment due, but you're on top of everything and you feel confident that you can get it done in a timely manner, then you won't be stressed out by it. But again, if you have other things that are kind of piling up around the same time, then you may feel some level of stress. And then secondary appraisal is then when you look at your coping resources and options. So we haven't defined coping yet, which is coming soon, but just look to see what's going on. Can you maybe talk to your professor about a more flexible due date? Is there work around the house or something that a friend or family member can help you with so that it frees up a little bit of your time? So you look at the other things that are going on and just figure out if you can make it work. So if you have time to look at it and really break down your schedule and get organized, you may see that, hey, I have more time than I thought, or hey, maybe I just really have to be focused and let's, turn off Netflix or Hulu for a little while and let's just really knock out this assignment. So secondary appraisal may show you that it's not as scary of a situation as you thought. All right, on to the major types of stress. So I will say for the exam, definitely be sure that you're using these 4 major types of stress, because if you Google major types of stress, it'll give you one wrong answer, which is not technically a wrong answer. It's just I'm asking you based off of the lecture and based off of the textbook, what are the 4 major types of stress? All right, so the first type of stress is frustration. So something gets in between you and a goal. It may be weight loss. Unfortunately, in society, we still put a lot of emphasis on weight and physical appearance. So you may get frustrated that you're dieting, you're exercising, and the scale is not moving. You are not seeing any difference. So that's one of many examples of frustration. It could also be something that we are all, I'm sure, familiar with, traffic. So it may be really frustrating to sit in traffic because you're at a standstill. Normally it takes you 30 minutes to get to school, and now it's taking you 45 plus minutes. Every baseball season, go through this frustration trying to get in and out of Dodger Stadium. Waiting like an hour and a half to get a mile from Chinatown into the stadium is really, really frustrating. All right, another type of stress is conflict. So that is when 2 or more incompatible motivations or behavioral impulses compete for expression. That sounds like a lot, but none of us are a stranger to conflict, I'm sure. It's just basically there are 2 options and they're not compatible. Say, for instance, you are invited to a playoff Dodger game, if you're a baseball fan, and then there's also a concert for an artist that you really like on the same night. So you may feel conflicted about that. Or if you are applying to colleges, you may get into more than one college and they may be really great options. So now you're conflicted about which one to go to. So both of these scenarios that I've given you are approach types of conflict. So approach is when like you want to approach both of them. Like they're both good options. So that's when you've got to pick between two or more really great things, but you can't have it all. Another type of conflict is avoidance. So that's kind of like the picking the lesser of evils. So say for instance, you're given the option of watching your bratty niece for a full day, or you can be at home just studying all day long. You probably don't really want to do either one of them. And your bratty niece is probably not going to be calm enough for you to get schoolwork done. I know this from experience. I don't have human babies, but I do have a niece who was a wild child. I would watch her when she was a baby, and I would always have these hopes and aspirations that I'd get some of my schoolwork done, and it never happened. Avoidance could also be like you could either schedule your dentist appointment today or you can do your physical exam. Usually people don't want to do either one of those things. And then we have approach avoidance, where it's not necessarily choosing between a good thing and a bad thing. It's more of our options can give us mixed feelings. So say, for instance, you get into a really great school, like you really want to join whatever program it is that they offer there. You've looked up faculty. The faculty seem great. Maybe you know somebody who's going to go off to that college with you, but then sometimes it's really sad to leave home. So you may feel conflicted about that because you want to go to school for this really great opportunity. But say you have a lot of close friends or family where you're at now, and so it's hard for you to move away and be away from your support system. There was a gal that I went to school with when I was in grad school. She was an undergraduate and she got accepted into a program, a master's program in, I want to say it was like Michigan. I forgot what university, but you know, we were going to school at Cal State LA, and she was from the LA area, and it was really, really hard on her when she left to go to school because she was just so sad and lonely. And it's like, yeah, you can meet people, but if you've been around your friends and your family for so long, you know, it's hard for you to really have those like deep connections right away. So one example of an approach avoidance situation. All right, the next major type of stress is change. So it's when there's a substantial alteration in your living circumstances that require adjustment. So keep in mind, these things can always range in their effects, like how stressful we find them to be. So one example of change would be something that I experienced short term. I broke my foot. I've actually broken my foot twice now. Same foot, same bone. But the first time I broke my foot, I had crutches for a few days before I could get to the orthopedic specialist. I'd already gone to the student health center. This was when I was in grad school, so I'd gone to the student health center. They told me that it was for sure broken. They took x-rays and the whole bit. But I had to wait to go to an orthopedic specialist. It was broken, so I couldn't put any weight on it. I was trying to get around on crutches with, oh my God, if you've ever been on crutches, it is a nightmare. And for people who do well on crutches, more power to you, because that is not for me. So anyway, it was just a little bit of an adjustment because I broke my right foot. So getting around was a little bit problematic. You know, I was used to driving myself. I was living with a roommate at the time, but our schedules were very different. So it was just change. Luckily for me, temporarily. But change could be something bigger. You could be diagnosed with a physical or a mental illness, and you have to adapt to what your circumstances are. One illness that comes to mind is diabetes. Say, for instance, you're diagnosed with diabetes, you're going to have to change some things. Maybe you have to change your level of physical activity. You know, maybe you weren't very physically active, and so your doctor may encourage you to increase your activity. Also, another thing that tends to happen with diabetes is people have to change their diet. So the things that taste amazing are usually the things that are not good for us. So that could be a struggle. And especially if you are living with other people, like if you're living with family members, you know, be it your like immediate family or even extended family or roommates, when other people are involved, sometimes it's hard because then they have to change their diet to kind of accommodate you, or you don't want them to change their diet, but you're trying to, eat less sweets and less fattening foods, and it's hard when you're tempted with it all the time. So sometimes things like that can be really stressful because it takes a lot of adjustment. And that stressful nature of something like being diagnosed with diabetes doesn't necessarily have to last forever. And then another major type of stress is pressure. So that is when expectations or demands that you behave in a certain way. So pressure can come from lots of people. I'm sure you're all familiar with the term peer pressure. So maybe your friends or classmates, usually I think we kind of get more of this peer pressure happening like early on, like elementary, middle school, even high school. But your friends are pressuring you to act or dress in a certain way. So you may feel stressed because you're kind of going against maybe your own beliefs or your own likes, wants, whatever. Pressure can also come from parents. So your parents may be putting the pressure on you to get into a good college, maybe go to a school like Long Beach City and then transfer to a university, but maybe that's not really something that you want to do, or you don't know for sure that that's what you want to do. Pressure could come from your teachers, professors. It could come from the workplace, so you can feel it from other coworkers or your supervisors. So pressure can come in many, many forms. All right, so now let's talk about responding to stress. So we've got emotional, physiological, and behavioral responses. All right, so some emotional responses to stress. Annoyance, anger, and rage. Those often go hand in hand with frustration. Something like sitting in traffic is annoying. It can make you really angry. For instance, I've been stuck in so much traffic going into Dodger Stadium that I've missed half of the game, even though I was a mile away at a restaurant. I mean, lesson learned, I just need to show up early, but still, it's frustrating, it's annoying, it's possibly could make you angry, could put you into a rage, depending on the severity of the situation. We may also respond with apprehension, anxiety, or fear. So if you are feeling like you are under pressure, you may be fearful that you're going to lose your job, lose your scholarship, make your parents mad, whatever the case is. When it comes to change, we may also feel anxiety and fear. Apprehension is something that we may feel when we are conflicted. So we're apprehensive to make a big decision because that could bring about a lot of changes. Another important thing to note, looking back at those major types of stress, a lot of times they're kind of not, there are situations that often fall in multiple categories. We try to break things down just for our own understanding as much as possible, but in life, when it comes to human behavior and the scenarios that we are faced with, things are complicated. So some other common emotional responses are dejection. Dejection, I always think of kind of like a mixture of rejection and depression. Like you're sad and you just feel like you're just like, is anything worth it? Like I'm just like, it's feeling like really down on yourself. And then there's sadness, which may come if we lose a loved one, if we're diagnosed with some condition that's really going to change things for us. And then we can also experience grief, again, if we lose somebody. We can also grieve for ourselves. So if you have to make a huge, huge change to like diet and exercise, or if you like lose a limb, you may grieve over the things that you're losing, the parts of your life that are permanently going to change. But we can also experience positive emotions. Usually, if we are able to kind of see the silver lining or look at the bright side, if we're able to do that, oftentimes we experience resilience. So we like bounce back easier from these stressful situations. And we'll talk about some of those positive coping strategies in a moment. But we can also look at stress as a motivating factor. So, say for instance, you didn't get into the college you really wanted to go to. Well, maybe you will try again next year. Or you're like, okay, didn't get into that school. Let's just work really hard and make the best of whatever school we did get into. Or, if somebody were to not get into the university of their choosing right out of high school, then they could choose to go to community college and, try to transfer later on. So you can always look at stress as motivation. All right, so these are some of the physiological responses that we have to stress. So Hans Selye developed or kind of outlined the general adaptation syndrome. This was in, sorry, that's my dog sneezing. Bless you, Mook. So this was in regard to our general everyday stress, because for a long time, psychologists knew and even physicians knew that big things, big events that were often negative have a big impact on us physiologically, mentally, emotionally. But Hans Selye, in about the 70s, I want to say, developed this gas model because we wanted to be able to explain why our everyday stressors are having such a negative impact on us physiologically. So according to the gas model, the first stage is alarm, so the fight or flight response. We'll talk more about that momentarily. There's also going to be more about that in chapter 9. So we have the alarm stage. So actually, let's talk a little bit about fight or flight now. So the thing is with our bodies, like I mentioned earlier, our bodies don't know the difference between something that puts us in grave, immediate physical danger and then something that's just like annoying and is going to wear on us every day. So it's like, being faced with a bear. Like if you're out in the wild and you see a bear, your body goes into the fight or flight response. So either you are going to try to fight the bear, which is not advisable, or you flee from the bear. I am not trying to give any survival tips, so please seek the advice from professionals on wildlife behavior. Anyhow, our body responds the same way it does to seeing a legitimate bear, like a literal bear, as it does to we're stuck in traffic and we're not going to make it to school or work on time. So our body doesn't necessarily go through that, like doesn't have that strong of a reaction, but it triggers the same processes in our body. So we go through the alarm, the fight or flight response, and then the thing about our everyday stressors is usually they're not gone right away, right? They usually hang out and they linger for a while. If you're stressed because you have school and work and you have to balance them and you constantly have to find time to do your homework, listen to lectures, what have you, that stressor's not going anywhere. It's hanging out with you for at least the entire semester. So we go through the resistance phase because our body is just like, okay, we've got this stress response. It's not going anywhere. And then we eventually get to the point of exhaustion. So our bodies quite literally just like can't deal with that sustained fight or flight response, like that sustained physiological reaction that comes with stress. And when we experience exhaustion, usually our tissues in our body are inflamed. We tend to get sick more easily because our body has used its resources to fight a bear that never actually shows up. Like that situation never goes away. All right, so the brain and body pathways. The HPA axis, which stands for hypothalamus, pituitary, and adrenal glands, stimulates production of hormones in response to stress. So again, these are the physiological things that are happening in our body. So our body starts to gear up for some kind of intense event. So the hypothalamus, you may recall from chapter 3, is this little control center. It has a lot to do with all of our normal functions. So that's there. So the hypothalamus can send signals to the pituitary gland and then also directly to the adrenal glands to start producing these hormones that are related to the stress response. So we start producing cortisol, among other things, and like adrenaline to get our body ready for action. So the other hormones that are secreted are catecholamines. We've got corticosteroids. You won't have to know those for the exam, but just to give you an idea of what's being triggered, what's floating around in our bodies when we experience something stressful. All right, so now on to behavioral responses. So that's where coping comes in. So coping involves efforts to master, reduce, or at least tolerate the demands created by stress. So what do we actually do in response to stress? What are some things you might do in response to stress? All right. So we've got some not so ideal coping strategies. And I say not so ideal because they're technically maladaptive. So they don't really do anything to help you fix the situation. But in small doses, I think these things kind of fall under the umbrella of self-care sometimes. So not knocking them entirely. One thing is giving up. Giving up usually doesn't help anything. If you give up on maybe getting into the school of your choice, then what good is going to come of that? You should push on and do what you want to do academically, even if it's not good, even if you didn't get into that school, still, make the best of the situation or go on to plan B. But giving up, period, not usually a good idea. Blaming yourself is also not a great idea. In small doses, it can be okay. If something is legitimately your fault, then it's probably a good idea to at least own up to your mistake, but don't continue to beat yourself up and wallow in it, because again, that's not going to get anything done either. Striking out at others, again, usually not a great thing. Sometimes it may feel good to kind of vent and to maybe yell at somebody, but generally speaking, it's not a good idea. Especially if that person is a coworker or a professor. Yelling at people just really doesn't accomplish anything. Usually it makes people just want to shut down in response to you yelling at them or being rude to them. Catharsis is another thing that's usually not great. Catharsis is when you allow yourself to just fully be submersed in your emotions. So if you're sad, it's only watching sad movies, only listening to sad songs, just being sad. And a little bit of that is okay. But just fully giving into sadness, usually not great. Same thing with anger. Indulging oneself is another not so ideal coping strategy. What are some things you may indulge in when you are feeling stressed out or sad? There are lots of things, right? So some of the not so great ones would be drugs and alcohol, just because that's not a good reason to partake in things like that. Not fully damning use of drugs and alcohol, but just saying those are not good coping strategies. Try to keep those for happy times, and also use responsibly. Some things that we indulge in: eating. Nothing wrong with a little comfort food when you're feeling a little sad or homesick or something. But not a good idea to continue to just let your diet be out of control and consuming a bunch of unhealthy foods. Lots of us had to deal with this when the pandemic hit. Eating ice cream every single day and having wine late at night and cheese and crackers and lots of other yummy things did not go so well for me. But again, I feel like you should at least treat yourself to yummy, healthy, or not so healthy, fattening foods every once in a while at least. Then there's defensive coping. So just when you get really defensive with other people, and that's the opposite of blaming yourself, right? When you just refuse to own up to any responsibility, that's usually a bad thing. And again, that's not going to get you anywhere. All right, so now let's talk about some positive ways of coping. So what is constructive coping? Constructive coping is when you confront the problem directly. Now, this is easier said than done in some situations, but maybe let yourself feel your feelings, maybe eat your feelings a little bit, and then try to move forward constructively. So positive or constructive coping is usually seen as problem focused rather than emotion focused. So if you're striking out at others, if you're blaming yourself, if you're just like feeling all the sadness via catharsis, if you're just indulging in whatever it is that you want to indulge in, be it a Netflix binge or food or alcohol, whatever the case is, that isn't changing anything, right? It's just dealing with the way you feel about it. So it may give you some comfort. It may help you like express some of the anger or frustration, but it's not changing anything. So constructive coping is when you change something. You're focusing on the problem. So again, for instance, you didn't get into the school that you wanted to get into. What can you do to fix that? It's probably, pretty much impossible for you to appeal their decision. Maybe there's an appeal process, but maybe it's that your GPA wasn't high enough or you didn't have enough extracurricular activities. So what are you going to do to help that problem? You can't guarantee that you're going to, do X, Y, and Z, and then it gets you into that college. But, again, maybe you can regroup and apply again next year while you build up your portfolio, your resume. Like maybe you didn't get the job that you wanted. Are you going to just be sad about it, or are you going to keep applying for other jobs? So what can you do to fix it? All right, based on realistic appraisals of stress and resources. So it's great to be ambitious and to dream big, but when it comes to dealing with stress and a particular situation, you have to try to look at it as realistically as possible. So if you are stressed out because you're taking 5 classes and you're working full time and you also have children, what's the realistic outcome there? Unfortunately, maybe the realistic outcome is you have to drop a couple of classes. Or you at least have to make sure that you're not stacking your classes where you're taking like a foreign language, which is 5 units, and like anatomy and physiology, which is 4 or 5 units. Maybe take a mixture of like really difficult, challenging classes with some of the ones that you can kind of kick back a little. Like ones that aren't so demanding, let's say. I'm not going to say easy. I'm just going to say less demanding. So you really got to take a good, honest look at what the situation is. Sometimes reappraisal is the way to go, so try to reframe it in some way that makes it look not so scary. Again, when it comes to like not getting into your school of choice, well, was there another school you got into? Maybe that school's closer to home. Maybe that means that you'll have more time with friends and family. Or, for if it's something that's affecting your body like diabetes, well, hopefully you caught it early enough and it's going to be manageable. I had a coworker who was diagnosed with diabetes like 30 something years before I met him, and he was good. He just knew the things he should eat and when he should eat, and he had things down, and his diabetes was manageable, and he was able to like eat normal things that, brought him joy, and he was able to like socialize and eat things at events and stuff like that. He just, had to be a little bit more cautious than some of us do. And you could, oh, sorry about that. My dog woke himself up. You could also reappraise that situation as, okay, you're diagnosed with diabetes, but now it's time to kind of get your physical fitness and diet kind of get things to be a bit tighter. Another thing you could do is minimize the harmful effects of stress on your body. So some ways to do that, sorry, I'm kind of moving forward a little bit. Well, we'll go on to this list because it'll talk about that. So again, reappraisal, it's a big one. You can use humor, so it doesn't mean just laughing everything off and like not taking things seriously, but just finding a good laugh in the situation is great. So I've broken my foot twice. I've broken my pinky on my left hand twice. And in all of those situations, as like frustrating as it was, I reappraised it a little bit. I didn't require surgery for any of my injuries. I had to have a cast for my pinky the one time. For my foot, I just had to use one of those boots. So I was like laughing at myself for my like big old Frankenstein boot. And you know, I would make jokes about it and stuff all the time. But because I was okay. Like it wasn't anything major. It was, you know, they were all painful, but not that painful. So like the reappraisal comes in with a like it could always be worse. And then the humor part, I've always been pretty good at being able to laugh at myself and not take myself so seriously. So a lot of times humor is where it's at. It just helps you deal with it. You can also release pent-up emotions without going full-blown catharsis. So you could find good constructive ways of dealing with anger, frustration, sadness, grief. So you could create some kind of art. That could be poetry. That could be music. That could be, you know, painting, drawing, what have you. You can find some kind of like artistic outlet for your emotions. You could also do something like go for a run or hit a punching bag when you're really upset. And that brings me to the next one, relaxation and physical activity. So up here at number 4, talking about minimizing the harmful effects of stress on your body, that could be via relaxation and physical activity. So the goal would be to get your body out of that fight or flight response. So chances are, if your thoughts are racing and you're feeling mentally like you're really stressed out by it, your body is also feeling those effects. So try to stop your body from feeling those effects, because having that stress all the time is what can be problematic for us in terms of like physical effects. So relaxation can be things like mindfulness techniques. You can focus on your breathing. If any of you are Apple users like I am, I've got an Apple Watch, and my watch will, when my heartbeat gets too high, it tells me to breathe. And, you know, so you can have little things like that, or you could just, you know, do it on your own. You don't have to have a device to tell you to do that. And physical activity, basically any physical activity of your choosing is going to be great for you. So I personally haven't really gotten back in the habit. Breaking my foot twice really disrupted it, but I like to run. I like to run outside mostly. So obviously be safe about it. If you prefer to run on a treadmill, if that's more comfortable or just easier for you, definitely do that. You know, you could go for a bike ride. You could ride a stationary bike. You can go to the gym and you can lift. All of that stuff is going to be good for you, because it's like a hard reset. Just hitting that reset button for your body to get it to like focus on other things and just to break up the release of all those stress hormones and things like that. Also, yoga and meditation are really great coping strategies. And we don't have to use these just for coping, right? We can use these to try to keep stress at bay. I have posted a video under the Module 2 materials page, so please check out the video on how our body responds to stress. All right, and then for the discussion forum, you're going to look at what are some aspects of everyday life that cause you the most stress. What is one constructive coping strategy you use? At least one. You can list more. If you don't think you use any of them, which one would you like to use more? And then for number 3, what is one maladaptive or non-constructive coping strategy that you use? And then, as always, don't forget to respond to a classmate to get all of your points for this assignment. All right, so last part of the lecture. So let's talk about stress and physical health. So we know it's bad for our physical health, but let's talk about why or how. So first, what is the biopsychosocial model of illness? Well, it's all in the name, right? So the bio part, what's happening in our bodies / what our genes contribute. So we may have a genetic predisposition to something like heart disease or cancer. We could even have a genetic predisposition to something like schizophrenia. The psycho part is what's happening in our mind. So our thought patterns, our feelings. And then the social part is our social interactions and cultural influence. So there may be cultural patterns in how we deal with stress or how stressed out we tend to get. All right, so this next bit, we're going to talk about personality, hostility, and heart disease. So many of you, I'm sure, have heard of a type A person or personality. So that is someone who has a strong competitive orientation. So everything's a competition. The second component is impatience and time urgency. So they want to not have to sit in traffic. Everything is like super urgent that they get done right away. And the third part, anger and hostility. We all experience anger and hostility at some point or another, but this is a type A person is somebody who is competitive all the time, who is oftentimes impatient and just wants what they want when they want it, and somebody who is very quick to get angry and hostile. And typically it deals with not having their needs met on their time, their schedule. So either they lose some kind of competitive, whatever it is. It could be bowling with your friends. It could be like a swimming competition or a running competition, anything like that. They could get very angry and hostile if they don't win. And then, sitting in traffic could lead to the person who is really angry and cursing and doing that whole bit, which happens and doesn't always mean that you're cursing at somebody. Type B personality, on the other hand, is somebody who is relaxed, patient, easygoing. So someone who does not seem to get stressed easily. So type A personality, definitely prone to stress, perceiving lots of situations as stressful. Type B personality, cool as a cucumber. A type B personality is also usually somebody who is really amicable or friendly. So because they're so relaxed and easygoing and patient with everybody, they typically tend to be friendly because people aren't as annoying to them as they are to people with a type A personality. So the key here is, the literature has looked at health profiles of people with type A personality versus people who would be categorized as having a type B personality. And the type A personality was often linked to coronary risk, meaning risk of heart disease, risk of heart attack. But a closer look at the research showed that people can be competitive. That's not going to lead to any negative health outcomes. And people can be really impatient, but that's also not going to lead to bad health outcomes. But it's the anger and hostility part that seems to be related to coronary risk, or being at a greater risk of heart disease and having a heart attack. So just think of the movie Inside Out with the little flamey anger emotion just blowing up at every little thing. That's not good for you because it takes your body from this resting position to just this like heightened activity, and it's just not good to constantly put your body through that. All right, now on to immune functioning. So our immune response is when our bodies have a defensive reaction to invasion by bacteria, viral agents, or other foreign substances. So our body recognizes that something is wrong. There is something attacking us that could be potentially harmful. So our body kicks into gear to respond to that threat. Studies involving both animal and human subjects show that there's a correlation. So there is a relationship between immunosuppression and stress. So there's a relationship between our immune systems not working so good and stress. So when we are stressed out, our immune system does not work very well, which is why often we see folks getting sick right around final exams. So it could be at the end of the fall semester or the end of the spring semester. Your body has just been worn down so much with all of your activity that it can't fight anymore. So going back to what Hans Selye said about the general adaptation syndrome, it's just our body has used so much of its resources to deal with the stressor that now we don't have enough left in the tank to deal with, cold and flu season and what have you. Chronic inflammation caused by stress may underlie many illnesses. So this is an idea that they talk about in that video. All right, see table 13.2 for a list of health problems that are linked to stress. But as I mentioned earlier in this lecture, when it comes to psychological disorders, stress is always on the list of contributing factors. All right. So let's talk about how we interact with our healthcare system. So how many of you really enjoy going to the doctor? Probably not many of you. Even though, like, I don't hate going to the doctor, but I don't like it either. Scheduling an appointment, sometimes a hassle. If you don't have insurance, which for, I think, half of my broken bones, I have not had insurance, and applying for, like, emergency medical is a nightmare, and it's just not fun. So, one way that we interact with our healthcare system is whether or not we even decide to seek treatment. So, most of us have probably some level of physical discomfort with something. Like for me, I get headaches a lot. You may have like an upset stomach or nausea that's going on for a while. But sometimes, and depending on the person and our pain tolerance, sometimes we don't always decide to seek treatment. And it could also be like a cultural thing. If the folks in your family don't often go to the doctor unless like something is falling off or bleeding terribly, then chances are you may have the same attitude about going to the doctor or to the hospital. Also, the way we communicate with health providers impacts our health outcomes. So it's sometimes hard to communicate with our healthcare providers. Sometimes there could be a language barrier. There could just be like a difference. I mean, there is most definitely a difference in education between you and your provider, right? So some healthcare providers don't necessarily have the best bedside manner, meaning they don't really know how to talk to people. So it could either be that they're like standoffish and cold, so they're not really somebody that's like easy to talk to, or it could just be that because they're doctors or nurses and they're surrounded by all of this like healthcare jargon, that they're just used to speaking in this kind of specialized scientific language. So it may just be that they don't realize that they're saying something that may go over your head. Also, the way we adhere to medical advice, sometimes we get a little bit creative with our adherence. So that is often called non-adherence. So say, for instance, you go to the doctor and they prescribe 10 days of an antibiotic. They tell you take it twice a day for the full 10 days. What do they always tell you? Take the full course of treatment. Even if you're feeling better, keep taking it. But how often have any of us maybe missed a dose, or we just stopped taking it because maybe it was unpleasant to take, maybe it had some like unpleasant side effects? Whatever the case is, non-adherence is common. So sometimes we just plain old forget, forget to take a dose of a medication. Sometimes we don't understand the treatment. So if a doctor is super vague, like for instance, I'll just put all of my medical issues out there. I suffer from a very dry scalp. So I went to my primary doctor for just a general checkup. But I was like, okay, well, since I'm here, let me ask about this dryness on my scalp and what I should do about it. So my doctor prescribed a steroid ointment and also told me to pick up a certain type of shampoo. So I did all that. But say, for instance, my doctor maybe like was kind of in a hurry or maybe just didn't realize how in depth she needed to go with the instructions. I could have left there not really knowing what she said and then finding myself not doing the prescribed routine correctly because I didn't understand the information. And I don't know if any of you experience this. I imagine at least some of you do. I have this bad habit of like when I'm talking to the doctor, like I feel good and confident, but it's like when I'm done with the appointment, I'm like, what did they just say? And sometimes it really helps to take notes, and I usually don't do it. It's also really helpful for you to take notes before you go to the doctor. So jot down some things about your symptoms, so that way when your doctor asks, you can kind of tell them about like frequency, severity, things like that. We may also have aversive or difficult instructions or treatment. So again, we may have some medications that are not pleasant to take. For me, with my scalp issue, putting a steroid ointment on my scalp is not pleasant. Like I have not the longest hair, but I've got, decently long hair, and trying to rub that stuff into your scalp and parting your hair, all these is just a mess. It was a literal mess and not something I wanted to keep doing. And then also sometimes we may have things that are really difficult. So again, I keep coming back to diabetes as an example. But with diabetes, it may be difficult to get a hold of your insulin. It may be difficult to administer your insulin to yourself. And it also may be difficult for you to adhere to the diet that your doctor has prescribed you. Because keep in mind, when we have things that are prescribed to us, it's not necessarily just a medication. A lot of times our medical doctors will tell us to do things a certain way also. So it could be things like diet and exercise. Also, our satisfaction with our physicians can influence if we adhere to medical advice or not. If you don't particularly like them, it may be that they don't seem very credible to you, like they don't seem to know what they're talking about, or it could just be that they don't give you the warm and fuzzies and you just don't listen to what they have to say. It's usually not that conscious like that. It's just when people rub us the wrong way, we're less likely to really value what they have to say to us. All right, so now on to factors that moderate the impact of stress. So one moderating factor is social support. Social support refers to various types of aid and emotional sustenance provided by members of one's social networks. So social support could be, sorry, that was a little hard for me to say. Social support can be your close family. It could be friends that are very close to you. It could even be your coworkers. If you have, positive, friendly relationships with your coworkers. And it could be on campus too. So it could be any number of people that are warm, cheery people in your life. So when compared to lonely, isolated people, people who have social support tend to have better immune functioning. They're usually healthier physically, and they live longer. So social support is very, very important. Think about the elderly community. For me, my great-grandmother is alive and well, and she has a ton of social support. She, has had some health issues, but she's got a really positive attitude, and then she's got lots of people around her. Luckily, she's got, she's got her children and grandchildren and great-grandchildren and now great-great-grandchildren, and she's such a pleasant person. We all want to spend time with her. So she's got that, and she also has friends who are also like in their 90s, like she is, and they're, again, not without their health issues, but they like to get together and call each other and things like that. So with social support, it helps us cope with life stressors. So my great grandma has definitely been through a lot. She's had a lot of loss in her life, but she also just has a lot of positivity. So when things are stressful, she doesn't let things get her down, or at least not for too long. She bounces back, and she's very resilient because she's able to look for the silver lining and reappraise situations. And social support really helps us do that. Optimism. So again, another positive aspect. Optimism is our general tendency to expect good outcomes. So even if something is ailing you now, you may be optimistic that you're going to go to the doctor and you're going to work out a treatment plan and things are going to be great. So it's a cute little cat that looks like my Benny. Hang in there. Optimists tend to engage in problem-focused coping strategies. So it's not just like, things will get better. It's like, how can I make things better? They also tend to make positive appraisals. So more of a tendency to look at stress as some type of motivation. So less likely to see events as stressful in the first place because they may respond to it like, hey, this is a challenge. Let me rise to whatever level that I need to overcome this challenge. And people who are optimistic tend to have a lot of social support because people want to be around optimistic people for the most part. You want to be around somebody who isn't doom and gloom all the time. Somebody who is able to, again, look at the bright side, look at the silver lining. because a lot of times if people are that way with themselves, they tend to be that way with other people too. So that could kind of be your hype person, the person who's really optimistic. All right, and then finally we have conscientiousness, which is a term that we are going to revisit when we talk about the big 5 personality traits. So conscientiousness is basically strong work ethic, like being hardworking. So being hardworking and holding yourself to high standards. Conscientious people tend to practice healthy habits. So if you hold yourself to high standards, you're probably going to be mindful about diet and exercise. So it doesn't necessarily mean you have to be a full-on health nut, but it does mean that you probably have a good idea of at least balance. Like, okay, I'm going to eat a cheeseburger for lunch, but maybe I should have something, like healthier for dinner. Or, yeah, I'm going to have a bowl of ice cream after dinner, so let me eat some veggies and some whole grains with dinner. Also, conscientious people tend to use adaptive coping strategies. If you're a hardworking person and you think highly of yourself and you think that you're capable of good things, chances are when the road gets a little bit bumpy, you're probably going to look for ways to make the situation better because you feel like you can and you feel like you deserve it. Also, conscientious people tend to adhere to medical advice. Just like you know more or less the things that you should be doing in terms of being active and eating a decent diet, you're probably going to understand that medical professionals probably know a thing or two about your condition, so you're going to want to listen to them. And it's almost like these things are little challenges to people who are high in conscientiousness too. Like your doctor said to take this medication every day and they said to do X, Y, and Z. So you're like, well, challenge met. This is basically my homework from my doctor, so I'm going to do it. Also, people high in conscientiousness tend to have higher socioeconomic statuses. So people who are hardworking and hold themselves to high standards tend to do well in school and they tend to get decent jobs. And as you'll see when we talk about emotion and motivation, we'll talk about eating habits a bit, and we'll talk about how socioeconomic status influences the things that we eat, the quality of the food that we eat. All right, so that's all for now. Remember to respond to the discussion forum and also take care of yourselves. Try to be engaged in these problem-focused coping strategies. Remember that indulging yourself at least a little bit is okay. That could be part of your self-care. So be kind to yourself and try to see that situations can sometimes be made a little bit better with some positivity and with some problem-focused coping.